The best thing that I could do is to continue to develop myself and my skills and be able to apply that to serve humanity, to serve our patients. And there's a fantastic opportunity to be able to do that as a GP.
So, Dr. Hisham, we recently talked about the negatives of being a GP. So, I wanted to flip that on its head and talk about the positives, because there are lots of reasons why, as doctors, we get into this job, into the healthcare service. So, tell me directly, what are the positives about being a GP?
Compared to secondary care, where quite often you're seeing patients who are unwell, they're in hospital for a particular period of time. In primary care, you have I like to say, the luxury of being able to follow up your patients, being able to keep in contact, build a rapport. Quite often, you'll see the same patients for various different reasons over and over, and you end up kind of building a rapport with the patient, sometimes the patient's family. It could be at the start of the journey when they're children, or it could be towards the end of the journey when they're frail or end of life. And I think that's a really rewarding aspect where you're their patient's doctor. It's a bit more tricky nowadays, where back in the days, you used to have your family doctor and he was your main doctor. But if you're particularly salaried in a practice like I am, it's quite nice to be able to kind of build that rapport with your local and regional patients. So that's a huge kind of positive, not to mention the kind of diversity that you see in general practice. You see every single kind of medical condition you can imagine, and you can, however much you can have a significant impact on your patient depending on how much effort you put in. So, for example, I've personally gone ahead and trained myself in joint injections and doing minor surgery, so I'm able to apply that to my patients in general practice. So there's a huge kind of scope to advance and diversify your working portfolio whilst working as a GP.
I think also, in addition to what you've said, the flexibility part of it as well, which I think the latest generations are looking for flexi working,
Yeah,
particularly with the way of general practice. And you can work in so many places, whether it's a GP, whether it's another specialist clinic, whether it's a private clinic, whether it's
yeah.
a sports doctor, whatever it is. And then you can pick your hours as well. So I think flexibility particularly lets GPs have that career of 40, 50 years working in one place, one surgery or clinic.
It's becoming more tricky to develop that kind of portfolio career, perhaps, nowadays, just because of the sheer kind of pressure with you used to be able to kind of locum and pick work as well as diversifying your portfolio, whereas now it's quite tricky just because of the sheer pressure on primary care. But there's still that compared to kind of other specialities, there's a huge aspect of everything that you've mentioned, as well as other academic things like medical education, going into research in primary care. So there's avenues for diversifying and flexibility for sure. Yeah.
So that's actually a headline recently where we need more doctors, but the funding is not in the right pockets to get those doctors. So now we have doctors sit in the middle and they cannot get jobs, even though we need more of them because the
Yeah.
funding is over here. In
Yeah.
summary, for those who are maybe not aware of the way that primary care and funding comes into the NHS. So that's an
Yeah.
unfortunate paradox. I just was thinking of something when you said about continuity. What you said is spot on the money, and I just wanted to provide one example as well. I remember a few years ago, I saw a lady who was trying to conceive, didn't see her again for some time. The next time I saw her, I was doing a baby check of her child, and I thought it's gone the full circle. So that's pretty amazing, and I still think about that sometimes. And that's the continuity that you have, and you build relationships, you become a pillar in the community. That doesn't really occur as much anymore because, as you've said, of these financial pressures or political pressures that come onto primary care
Mm.
that we're not able on the ground level at grassroots to necessarily make the changes we want to.
It's in primary care, you have that ability to liaise with different specialities and be able to kind of aid diagnosis of a condition. So I had a patient who, over a number of months, had a particular kind of medical concern, and I had to liaise with a different number of specialities. And it took a total of 12 months. And the patient luckily wasn't in pain or suffering, but he wanted to know what the diagnosis was. And it was a pretty significant, rare thing to come across. But it was a number of tests, and eventually one particular test which we organized, which found that diagnosis. And it was the patient got closure. He was, over the moon that he knew what was going on, even though there wasn't much that we could do about it. And for me, it was rewarding as a doctor to kind of develop my clinical knowledge, be able to understand these kind of rare things that you see as well as common things, and be able to be part of that patient's journey. And because of that whole process, he built this kind of strong rapport and trust in myself in his as his doctor, which is quite humbling. But it's one of the positive aspects of primary care, that follow-up continuity that we're talking about
Would you say that's the best thing that you've done?
on a personal level. I don't think there's one particular thing that I could say is the best thing. I think the best thing that I could do is to continue to develop myself and my skills and be able to apply that to serve humanity, to serve our patients. And there's a fantastic opportunity to be able to do that as a GP.